Infertility could take a toll on your emotional health. It's very stressful for a couple who have dreamed of a baby ever since they got married. With today's advanced technology, there are many reasons for these couples to stay hopeful. Fertility treatments keep getting better and more babies are born using artificial techniques. If you are looking for fertility treatments, here are a few pointers before you make that appointment. Fertility drugs. In this kind of treatment, the drugs are taken in pill form or are injected in the bloodstream. These drugs are known to release hormones that induce ovulation or boost egg production. They also make the uterus to be more receptive for embryo plantation. This method is useful for infertility that's caused due to irregular ovulation. It has been observed that around 60% of the women who take this treatment successfully ovulate. This is mostly the first treatment approach used for infertility. Artificial insemination. In this process, specially prepared sperm is directly inserted into the uterus by using a thin, flexible catheter. This method is generally combined with the first method, and your doctor will definitely recommend drugs along with artificial insemination. This method is used when men have slow-moving sperm, lower quality sperm, or a low sperm count. Donor sperm. Sperm from a donor is used for fertilization in the artificial insemination or in vitro fertilization. This is generally a preferred treatment when couples face male factor infertility or genetic disorders that they do not want to pass on to the next generations. In vitro fertilization. In this method, the eggs and the sperms are externally fertilized in a lab. The embryos are developed in a lab and are implanted in the uterus later on. This treatment proves beneficial for older couples. Surrogacy. In surrogacy, another woman carries the baby. Artificial insemination is used for the purpose of fertilization. In vitro fertilization can be used and the embryo can be directly transplanted in the uterus. The success rates greatly depend on the quality of the sperms and eggs used. Donor embryos. In the process of in vitro fertilization, sometimes many embryos are formed by fertilization, but just one is used. The remaining embryos are used in the donor embryo method for couples who need it. The success rates depend on the quality of embryos transplanted. Reproductive surgery. If there are anatomical abnormalities that are contributing to infertility, reproductive surgery is the best way to correct it. Some of these surgeries remove scars, clear blockages, and correct the underlying anatomical defect. The success rates here depend on the individual's condition and age. This is an invasive method and could increase the risks, cost, and time too. It is however important that you select the right fertility clinic for your treatment. Ensure that you understand the treatment recommended and check whether the clinic you choose specializes in that treatment. Technology has changed quite a few things and there are plenty of treatment options for infertility. Never give up hope.